Hello everyone, my name is Maria Clara and I will be presenting my seminar on the topic Asthma and Obesity. Asthma is a highly debilitating chronic inflammatory disease of the airways, affecting most 300 million people worldwide. The variable degrees of bronchoconstriction, mucus, hypersecretion, and inflammatory process triggered by exposure to the allergen result in the most common symptoms: coughing, wheezing, and shortness of breath. The factors that are associated with the development of asthma are methane, animal hair, smoking, climate change, allergies. Chronic inflammatory respiratory system disorders cause polarization of the immune system answer to T helper 2 and increases the production of interleukin 4, 5, and 13 cytokines. These cytokines alter the class of antibody to IgE and increase eosinophil infiltration in the respiratory tract. The allergic immune response begins with allergen contact with the epithelium in the lungs, promoting its activation and the release of thymic stromal lymphopoietin, interleukin 25 and 13-3. These cytokines trigger activation and migration to the peripheral lymphoid organs of dendritic cells, where they prime T cells to polarize to T helper type 2 and follicular helper T profiles. The cooperative interaction between disease T cells and cognate B cells promotes T cell differentiation and migration to germinal centers, in which they induce IgE production by activating B cells. Altogether, the antibody production and T-cell release of interleukin 4, 5, and 13 result in mast cell activation and eosinophil recruitment. Among the CNCDs, obesity has been highlighted in the last 30 years. Prevalence of obesity has increased by near 28% compared to adults and near 48% among children. Obesity can be defined by the excessive accumulation of fat in the adipose tissue or by the increase in body weight due to excess fat when compared to pre-established values. Changes in eating habits in the routine of the population combined with genetic factors are responsible for the current epidemic of obesity, which represents a risk factor for chronic diseases. Obesity is considered a global health problem, with the growing number of cases projected to reach 700 million cases by 2025. The exact definition of the cause of obesity is still unknown as a result of the complex relationship of biological, psychological, social, and behavioral factors, in which factors such as the individual genetic and epigenetic, their microbiota, circadian cycle, endemic factors, socioeconomic issues are present, and culture. Food choice resulting from the social environment in which the individual is certainly also play an important role as they influence the quantity and quality of calories ingested. Asthma and obesity are diseases with high prevalence and a significant increase in recent decades. Both have different etiologies, clinical phenotypes, and severities. Asthma and obesity present raise incidence, and their concomitance is a reason for concern, as obese individuals are usually resistant to conventional asthma treatments and have more exacerbated episodes. Obesity affects several features in the lungs during asthma onset, shifting the therapy type 2 eosinophilic response towards a TH17 neutrophilic profile. Moreover, those individuals can present reduced atopy and delay cytokine production. Obesity affects asthma-related immunohistopathological parameters. In Italy, TSLP and interleukin-25 levels were lower in lung homogeneity of the obese allergic group in comparison to the lean allergic mice. 24 hours the last changing. At the same time point, obesity allergic also showed reduced CCL11 and a tendency to reduce interleukin-5 levels. These mounting caries were followed by a persistent reduction in eosinophilic counts associated with diminished EPO activity at the 48 hours end point. Chronic non-communicable diseases are long-lasting diseases resulting from a combination of genetic, physiological, and behavioral factors. In contrast, interleukin 4 and interleukin 17 levels were increased in obese allergic compared with the allergic group. Obesity affects serum over specific antibody titers. IgE levels were lower in the obese allergic group in comparison to the allergic group at 24 hours and 48 hours after the last changeling. On the other hand, more IgG2A antibodies were produced in the obese allergic group at both analysis time points. The results have demonstrated that obese allergic mice present a delayed immune response. The pro-neutrophilic shift is associated with more exacerbation episodes and resistance to the conventional corticosteroid treatment. The high IgG2A titers could be a consequence of obesity-triggered disturbance. These were the references used. Thank you for your attention.